Hello everyone, my name is Hugh, and today I will be talking a bit about the Capgras Syndrome, or the Capgras Delusion, which is in Chapter 8 of the Phantoms in a Brain book by Dr. Ramachandran. So, Capgras Syndrome, what is that? It is a very rare case of, there's actually a lot of theories on this, a very rare case, but for the sake of this book, we are talking about brain damage, because the patient in there named Arthur is damaged or had an accident and that damaged his brain, hence he cannot actually just damage his brain. What happened was in the Capgras syndrome is the patient is very lucid and he is very mentally stable, but the problem is he regards his close acquaintances as imposters. He can recognize their familiarity. He can recognize that they look alike or they look very similar or identical to his parents, to the parents, but to them they are imposters, despite that they look exactly alike or identical. Technically, they are his parents. We just have that problem that he can't identify. We'll go on that. So a little bit of history. What happened is this situation is frequently in psychotic stage, but a third of the case happens through brain damage. This is what Dr. Ramachandran is trying to figure out, which part of the brain was damaged. So, in his book, he talked a little bit about the visual recognition part. There are actually two visual recognition, not just one. There's two components of it. The first one is your conscious recognition of the face, and then your semantic information. So that is, I think, based on my understanding, is your occipital lobe and whatever action potential that, basically your vision, whatever your vision is that you're looking at, goes back into your occipital and then it goes out to your temporal for identification. That's the regular pathway. But the second part is the main part in the Capgras syndrome. The second part is your limbic mediated emotional arousal. Basically, that limbic part is your emotions, your familiarity feeling that accompanies your consciousness recognition of the face. So what happened is, after you identify that person through your temporal lobe, you will relay that message to your limbic system for emotional response to that vision. And that comes up with like your familiarity and all that stuff. So Dr. Ramachandran was basically thinking that why it happened in Capgras syndrome is that the connection between that vision part and that limbic emotional response part, the relay, the neural network, or not neural, there is a disconnection between that, between the between your conscious recognition phase and your emotion. There is a disconnection between those two, hence you cannot, or hence the patient with Capgras syndrome cannot recognize their close acquaintances because there is no emotional involved in it. This is a pretty interesting case because what Ramachandran did was he tested the patient through this test called the GSR test. Basically, it tests your skin response to stimuli on the autonomic nervous system based on vision. So what happened was when a person looked at something emotionally salient, like his parents or something like that, he will elicit, or actually the message will go to your limbic, which is your emotional part, and into the hypothalamus and whatever else from there. It goes into the autonomic nervous system. That would generate some sort of a change in your sweating, heart rate, etc., etc., something like that. So that test is basically tested skin response to looking at familiar faces, facial expressions, or faces. So he tested on a lot of other patients with Capgras, and he found out that the changes or the difference between the GSR of a normal person and GSR of a another person, or of a Capgras person, is completely different from one another. The GSR from a normal person like us, like you and I, will have a very high changes in sweating whenever we look at our mom, our dad, or whoever else that we know, close acquaintances. But a GSR in a Capgras person shows very or no little, or very or little changes, or even none at all. So that proves that there is a damage between the connection of the your vision or your conscious recognition of face and your emotional part of it. It is also interesting that he found out that there is a lesion effect in the right frontal cortex, and maybe a conjunction of the two lesions between the frontal and the temporal area. And he found out that the temporal and the right frontal parietal lobe were damaged, as well as several other enlargements in the, for example, in the encephalomalacia, in the bilateral areas. And that's pretty much what I've found so far, because it's such a rare case that I cannot find anything else online. But one interesting case before you go is that Capgras is a mirror image to a prosopagnosia. In prosopagnosia, what happened is the person cannot identify that person at all, regardless. But there is a bit of I guess there is a bit of an emotional recognition to that. He just cannot recognize it. So what happened was, here's your visual cortex. Let's compare the two real quick. In a Capgras syndrome, here's your visual cortex or visual input. It will send that message to the striate cortex, which is your temporal lobes area. Then the covert part is your facial recognition. In Capgras, it's working okay. It's working fine. But in the overt part is your emotional part, is damaged. Hence, whatever you send to your limbic system is just your physical visual, but your emotion is not there. That's why you cannot recognize. That's why a patient with Capgras cannot recognize that person, even though despite that they're close acquaintances to him. In prosopagnosia, it's the complete opposite. What happened is the recognition, the physical vision is not there at all. But emotionally, it is there. They're completely mirror images of one another. So a lot of people are saying, or a lot of scientists are studying prosopagnosia along with Capgras because they are mirror images of one another, and they both have the same problem or the same disconnection. Not the same, but kind of mirror image disconnection between the two, vision and emotion. So that is pretty much all I have to say about that. Thank you for listening.